people need to start feeling confident, not only about the vaccine, but about the ethical practices of medicine in relation to our community.
If one particular community remains unvaccinated, then the virus will seek them out and will go through that community like wildfire.
There is much more vaccine hesitancy among some of our Black, Asian and other ethnic minority communities.
I'm planning for a family in future, and the rumor saying that it can affect your fertility.
You feel restless after taking this vaccine.
When you are invited by the NHS or your GP to go for your jobs, do not hesitate.
A very good evening and welcome to a Sky News special programme on vaccine hesitancy. The first phase of the vaccine rollout is now complete. More than 15 million people in the UK have now been vaccinated, and the government says that the jab has been offered to everyone in the first 4 most vulnerable groups. But in some Black, Asian and minority ethnic communities, the take-up has been low. The Chief Executive of the NHS, Sir Simon Stevens, tonight described it as a pandemic of misinformation, which is fuelling vaccine hesitancy. Well, tonight we'll discuss those concerns and look at what needs to be done to help people feel more confident about the vaccines. I'll be joined by a panel of experts and we'll be putting some of your questions to them. But first, Sky's correspondent, Ashna Hurinag, has been speaking to people in BAME communities.
When you are invited by the NHS or your GP to go for your jobs, do not hesitate.
Sermons come with a message of reassurance at this mosque in Birmingham, as next door another prayer room operates as a vaccination centre. This was the UK's first mosque to offer the jabs. It's doing hundreds a day, but it sits in a city where in some areas nearly half of people are declining the vaccine over unproven fears.
We have a lot of other things. Will it affect my fertility? If I have the vaccine, will somebody track me? So there is a lot of mistrust about it.
Hesitancy is highest among Black, Pakistani and Indian people, despite these ethnicities being more likely to die from COVID-19. In Newham in London, despite cases here at one stage being the highest in the country, rumours have led to anxiety.
I'm planning for a family in future, and the rumor saying that it can affect your fertility. So that's the main factor, and apart from that, many other factors, because it's just been like a month, people having vaccine, so the outcomes will take time.
I heard you feel restless after taking this vaccine.
If someone told you that wasn't true, it's okay to take it, would that change your mind?
Yeah, if doctor said, yeah.
This scepticism is a national concern, but those getting their vaccines in Birmingham are ignoring the misinformation.
I did not listen to anybody else or the community groups. You get so many messages in WhatsApp and all that. I never listened to it because I'm listed extremely vulnerable. I thought whenever I get my chance, I'll go and have it.
If NHS are spending so much money in UK, our duty is to take the injection and support them, because NHS are looking after us.
The question has always been, why does this vaccine scepticism exist? Why the reluctance and resistance to have this jab? Well, all the communities are different, but some of the issues they have in common include believing myths and historical misbeliefs that have been fueled by what people are watching and listening to on these.
This vaccine is experimental on the human race.
Social media videos containing disturbing and false information have spread within some communities. Reverend Mbunge says for many they have exacerbated mistrust that stems from a long legacy of medical mistreatment.
We found that the Black community has had a disproportionate experience around the experimentation of medicine on our community. So people need to start feeling confident, not only about the vaccine, but about the ethical practices of medicine in relation to our community. I think you would recall there was even two French scientists who have alluded to the fact that it's all right to test some vulnerable parts of Africa where they might get a bit more experimental opportunities. That should not happen.
Those in the NHS acknowledge there is no quick fix to heal the anxiety, but COVID-19 doesn't give them the luxury of time.
There's definitely low trust amongst the ethnic minority communities that we need to look at. And that may well be historical, but it's not just about a decision of whether you're going to take a vaccine or not. There's wider implications here. It's about protecting the health of your loved ones.
Community leaders say more education is needed to encourage the fearful. A vaccine milestone may have been reached, but there are many more miles of confidence building ahead to ensure swathes of society aren't left vulnerable.
And Asha's now here with me in the studio to discuss her report in a moment or two, but I'm also joined by Dr. Zubaida Haq, a member of Independent Sage and former interim director at the Runnymede Trust. We've also got Helen Donovan, professional lead for public health at the Royal College of Nursing with a specialism in vaccinations, and Imam Kari Azim, the chair of Mosques and Imams National Advisory Board from Leeds Mosque. A very good evening to you all, and I'd like to kick off with you, Dr. Haq, and we'll get into some of the reasons, the whys and wherefores for this vaccine hesitancy in a moment or two, but just tell me your overall concerns about these statistics, these findings.
A successful vaccination programme will not be successful if it's undermined by low vaccine uptake. And essentially, this is the nub of the issue here, which is that we have low vaccine or evidence of low vaccine uptake, not only among Black and ethnic minority people, minority communities, but also among deprived communities and also among Eastern Europeans. We know vaccine hesitancy issues exist more in women than men, more in younger people and so on. So my biggest concern here is not that it's just an issue specific to particular ethnic minority communities, which, by the way, is important because we know that Black and ethnic minority communities and people from deprived areas have been much more vulnerable to severe COVID illness as well as mortality from COVID-19. That's important. But vaccine hesitancy is clearly an issue across different communities. And in that sense, we need to address it because at some point, what's a marginal issue, or if you like, an issue on the side at the moment, can tip into the mainstream.
OK, your opening thoughts. Imam Azim, let me get your sense of what do you hear within the community about vaccine hesitancy? Why do people who don't want to take the vaccine, why do they say they think that?
I think there are wide and varied reasons for hesitancy in taking a vaccine. And as Zubaida Haq says, it's not just the Black, Asian, minority ethnic communities, but there are other minority communities or marginalized communities that also are showing hesitancy. And I'd also like to explore whether it's hesitancy, like I not want to take the vaccine, or it's just a cautious approach at this moment in time. There are also intergenerational issues. I've been holding webinars across the country with Muslim communities and also other communities. And what I find is that elderly generation, they have slightly different reasons for their hesitancy to some of the young people. With young people, it may be more lack of trust or also micro nanochip issues, whereas with the elderly generation, it's more to do with side effects and what impact vaccine will have on us.
And Helen Donovan, just underline for us your concerns and why this matters, because some people are going to say, I thought vaccination was a matter of personal choice. It's up to me.
It is a matter of personal choice, but it's really important, as both the other panellists have said, that we have a really high rate of uptake across all of the community. And I would absolutely agree with the sense that the Imam has just said about vaccine hesitancy and exploring some of that, because asking questions about a vaccine or any treatment isn't unusual, and it's not wrong. And we should be expecting people to ask questions. And I think what we need to be able to do is get to communities and be able to answer those questions because it's absolutely right that different people will have different fears. It might be because they're worried that the vaccines have been tested so quickly and we should be able to address that. Or as one of the ladies on the video clip that you showed about fertility, and we can dispel those myths. And I think, as she also said, if she has that explanation from a healthcare professional who's able to dispel those myths, people by and large do trust that information. But it's about us being able to get into those communities and be able to give that information in the way that people need it.
Well, thank you all very much indeed for your opening comments. We're going to be drilling down into some of those issues much more deeply in the next 45 minutes or so, and also taking some questions from Sky News viewers. But I want to bring in Ashna in a moment. But first, let's take a closer look at some of the data that she's uncovered in a study of over 11,000 UK adults. Get this. 82% said they would likely or very likely have a COVID-19 vaccine. But this figure changes very dramatically for solely black or black British adults, with nearly 72% stating that they were unlikely, stroke very unlikely, to be vaccinated. And Pakistani, Bangladeshi adults are 42% unlikely / very unlikely to be vaccinated. And as I say, Ashna joins me now. We're taking that survey in with your reports. I mean, we're all very concerned about this, aren't we? Just tell us some of the voices, some of the people you spoke to, what they were saying.
It's really interesting, Dermot, because the reason why this is newsworthy, the reason why it's interesting is because we know that these communities are disproportionately affected by this virus, and yet you've still got members of those communities who are fearful. And it's interesting that some of the myths share some similarities, even though these people are from various different communities. You've got myths surrounding the ingredients, you've got myths surrounding the side effects, but all of these appear to be built upon some deep-seated multi-generational fears and reservations that some people have, to do with trust, to do with authority. And that's not just across the board, that's particular towards the black community, for instance. But one thing that's interesting is that anti-vaxxers are really, I guess, playing on this concept. We have seen this rise in disinformation, in rise in fears, especially on online platforms. And I think that's why you've seen today the chief executive of the NHS, Sir Simon Stevens, addressing that we're tackling two pandemics. We're tackling the actual virus itself, but we're also tackling the virus, the pandemic of misinformation. And that's what we're going to tackle over the course of this next hour or so. Ashna, for the time being, thank you very much indeed. As I say, we've got some questions being sent in by Sky News viewers. Let's address one of them now. This is from Iamide Thomas, who asks, Black and Asian participants in the vaccine trials are reported to be comparatively low. Was there any indication that the vaccines might work differently in these ethnic groups, given that for a variety of reasons their COVID-19 morbidity and mortality rates are worse than other groups? Good question, Iamide. We might have not have time to get round to all our panellists, but let me ask you, Helen Donovan, the trials, would they address Iamide's concerns?
So we know from the trial data that there was a very broad group of wide ethnic minority groups were tested, and the trials were done in various different countries. Obviously, we're looking at, relatively small numbers in comparison to the now rollout of the vaccine programme. But the evidence is that it was tested along, a very, very wide group of people. So I think we can assure people that actually there was good trial data across all ethnic minority groups that have been tested, and no evidence that the vaccine worked any less effectively in different groups. So I think, yes, we can assure people on that.
OK, and Dr. Hack, overall, let me add in that a lot of people from all communities also noticed how quickly these vaccines have been developed, and some people saying, well, can they really be safe with that amount of speed behind them?
Scientific feat how quickly it was developed, but I think what's important to acknowledge is the amount of money that was put into this, the reason it was developed so quickly is because of the sheer political force, the sheer resource that's been put in. And normally vaccine trials are much slower because they don't have that political backup, they don't have that resource, they have to go through lots and lots of different committees and so on. And all of that was escalated. I want to go back to your original question that you asked, Helen, which was around different ethnic groups being involved in these trials. I think it's really important for people to know that Black and ethnic minority groups were involved in the trials, but also there's no one gene for being Asian. There's no one gene for being Black. So, you know, to expect that trials can take into account Black and ethnic people in that way is ridiculous. What we need to do, what needs to happen is for trials to take into account all sorts of different backgrounds, different bodies, different comorbidities and so on. And that's what these trials have done. The other thing I want to say very quickly is we keep coming back to the same point around misinformation and misperceptions. And it's really, really important to say one thing, which is that the only way to counter misperceptions and to counter misinformation is for the government to set up a website, because the government are trusted, but to set up a website, a trusted website, which has accurate, up-to-date information about the vaccine, about vaccine rollout, about who's taking it, about who's not taking it, so that everybody in the country has a single source of information. And at the moment, we're not seeing that from this government.
And Ashna, that is the point, isn't it? That misinformation, you came across it, it's everywhere, and it's transmitted in so many different fashions. So many different ways. I mean, social media, we know, is a tool that can be useful, but it also can be quite dangerous. And that's what's certainly something that we're seeing, especially with the older communities, the older people who are not sure where this information has come from. They're seeing it's potentially from a medical professional and they're believing it because on the face of it, that's where it says it comes from. And Imam Azim, just specifically on that question, that the trials were not particularly aimed at or didn't deal enough with concerns within one community. Have you heard that, any of those kind of voices?
Absolutely, yes. I have come across that premise. Also, the fact that I think that the fact that there were less people volunteering for the trials also goes to show that there is perhaps mistrust among certain members of the communities, which has continued to reinforce the point that people do not trust the source. And but having said all of that, I think it's important that the trials, the assessments that took place did include people of all backgrounds, and we are confident about the safety of the vaccine. And from religious perspective, you know, I can say that we as imams and scholars have consulted with medical professionals and others, and we are confident not only about the safety and efficacy of the vaccines, but also that there should be no religious hesitation in taking the vaccine. The mistrust exists, but we need to have trusted individuals as well as organizations, institutions involved in delivering the message in a culturally sensitive and delivered in a way which people can relate to. And that's why where you see vaccination centers being opened in community centers or mosques or places of worship has actually boosted people's confidence to take the vaccines.
OK, hold those thoughts, because we're going to have a short break coming up on this Sky News special programme. We're going to be discussing more about the health concerns among BAME communities. Stay with us. We want to take a further look at some of the reasons why people from Black, Asian and minority ethnic communities could be hesitant about the vaccine programme. Now, in a recent Office for National Statistics survey, almost 2/3 of adults from an ethnic minority background who said they were unlikely to get a jab said they were worried about potential side effects. Now, that's compared to 45% of adults of white ethnic background. Well, before I speak to the panel about that, let's just hear on that issue from Mashkoura in Birmingham.
I'd like to ask, as a Muslim woman, would it be suitable for me to use the vaccine in terms of the ingredients it contains? Is it halal? Would it be suitable for those of Muslim background?
Well, Imam Asim, that's a very specific question from Mashkoura. Again, it must be something you hear quite often. I'm sure it's asking as a Muslim woman, would it be suitable for me to use in terms of the ingredients it contains? Is the vaccine halal?
Yeah, absolutely. The scholars in the UK and abroad have confirmed that the vaccines used in the UK do not contain any animal product or human embryo. It does not contain gelatin or alcohol. And as a result, the vaccines are absolutely halal. They are permissible under Islamic law. In fact, many imams have been actually making videos of themselves being vaccinated to reassure communities and inspire confidence in people that the vaccines used are absolutely halal. There should be no religious hesitation, from religious perspective not to take the vaccine.
And Dr. Hack, just underline that for us. The ingredients of these vaccines, they've been developed by different routes, but just underline for us that they are all very, 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 I can't get enough verys in, they're safe.
As far as we know, as far as the data shows, that all the ingredients are compliant with the dietary requirements of most of the faith groups. But I think, just to go beyond that, I think I want to go back to something that Helen said earlier, which is we have to recognise that this isn't just about myths and misperceptions or irrational ones from groups. What we know from vaccine hesitancy research is actually it's a really diverse set of concerns and anxieties, most of which are very legitimate anxieties. To have anxieties about fertility, to have anxieties about side effects, particularly when you've been among groups that have been very vulnerable to COVID-19, when you've looked around and you've seen more people from your community going into hospital, being hospitalized with COVID-19, dying from COVID-19, I think these are really rational questions to ask. Hang on, will these vaccines have side effects that would be very detrimental to me? Are they being rolled out too fast? What's in them? Will it affect my fertility and so on? And Independent Sage, we have meetings, public meetings every Friday, and we've heard these concerns from all sections of society, which is why, once again, I want to go back to the fact that in order to address these fears, there will be lots of different ways of addressing it. But it's not just about working with faith communities and community groups, although that's very, very important. It's also about having a national website, about the government leading this public health messaging and awareness raising campaign, working with local trusted public health professionals and providers, as well as faith groups and community groups, in order to reach these communities. And finally, I want to raise another point, which is vaccine hesitancy is also about access. And we need to address issues around access, whether people have the transport, whether they can afford to take some time off to get the vaccine and so on. So we need that comprehensive, if you like, communication strategy, as well as research to find out what that vaccine hesitancy is about.
OK, and some of those points we're going to return to at the end of this hour. But another question, another thought coming from one of our viewers, this from Toby Agye, who asks, are the side effects of taking these vaccines different for, say, an ethnic person than their white counterparts? So overall, it's about side effects. I mean, are there any side effects, whatever nationality or ethnicity you come from? What do you think about that, Helen Donovan?
Well, I think, as been said before, I mean, there's no reason to think that any particular ethnic group is going to suffer side effects over and above anybody else. But I think, going back to the points that have been raised from Zubaida Haq and Iman Asim, it's about being able to address those particular concerns. And we know from all vaccine programs that the first thing that people will ask is this vaccine safe? And within that, what are the expected side effects? So explaining to people what the side effects are likely to be is really, really important. And there are leaflets and information and videos available on the NHS websites and on the public health websites. And I think one of the things for me, particularly from a nursing perspective, is making sure that my nursing colleagues and others have access to that information so that they're able to disseminate it to people. Because, you know, going back to what I said before, it's absolutely right and, you know, understandable that people will have these questions. But I think in terms of whether certain people will have more side effects, there isn't any evidence from any of the data that we've got that would suggest that there is. And we can be assured of the safety of these vaccines and their efficacy in preventing severe disease, which again has been said has particularly affected the Black and Asian minority groups, you know, exponentially in this with COVID-19. So it's really, really important that we get those messages over.
OK, and let's get some more messages over. So many questions coming in. This one from Esther from London, this one on video. Let's have a listen to Esther.
I'm at the age where I'm considering fertility. Is this vaccine safe for me? With statistics around the lack of care Black women like myself have had with the NHS, Black women being 5 times more likely to die at childbirth compared to their white counterparts. How are people like myself to trust and believe the vaccine which is being administered by the NHS?
OK, well, that's a very good question from Esther. I'm sure, Dr. Hack, you'll agree. Would you like to put Esther's mind at rest? Because, of course, the vaccine was not tested on pregnant women at all, was it?
No, but I think one of the vaccines, and forgive me, I can't remember which one, has now said that it is safer for women who are trying to get pregnant. But yes, no, it hasn't been tested. And I think Esther's absolutely right to be nervous and to have some anxiety, because we know, for instance, that Black women have been 5 times more likely to die from childbirth, childbirth in this country, and very little has been to address that. Very little has been done to address that. And that's quite an important issue around vaccine hesitancy, because these are, lived experiences of Black and ethnic minority communities in this country, where they feel they have been failed by health providers, by health services, by the government. And we don't have to look very far back to see that. That's one of the reasons why Black and ethnic minority groups are disproportionately dying with COVID-19 in this country. But I think, once again, we have to go back. Once again, this is something that the government needs to address, working with the pharmaceutical companies, working with health providers, working with NHS public health professionals to share that information. And I think right now, it's important to watch that information and to have the government lead the way on this.
And actually, just very quickly, I mean, we're halfway through this hour, so just I see you nodding each and every question that comes in. I mean, this is precisely what you've been coming across during the course of your reporting on this issue.
Yeah, it is interesting to hear all of those guests talk about those issues, because they're very real and they're legitimate concerns. When you're talking to people and you're asking them, OK, what's making you nervous about this vaccination? They're almost hesitant to even tell you, because they're slightly embarrassed by it, but they're very real concerns to them. You don't want to be laughing at them when they're telling you what they're hearing. I think it's really interesting that a surgery I heard from today, only in Luton, said 100% of their patients who are Black either refused to have the vaccine or said that they haven't decided whether they want it yet. That's a surgery in Luton.
Every single Black person registered that had been offered the vaccine. So
that had been offered the vaccine.
Got to caveat that. OK, well, let me put that to you from Esther, Helen Donovan. I mean, it is quite damning that. On the NHS, Black women are 5 times more likely to die at childbirth compared to their white counterparts. How are people like me, she said, to trust and believe the vaccine that is being administered by the NHS?
Yeah, I think this goes to the crux of it, doesn't it, really? Because when you have a minority groups who don't feel that the services are for them, and they don't recognise the services of being able to deliver care for them, then we've got, it is going to be a long process to get that information, information out to them. And I think that one of the things that we know from other vaccine programs is that it isn't just about the national information. It's about giving people the opportunity to ask those questions on an individual basis. And as, again, some of your survey respondents said, having that information from a healthcare professional is really powerful. And we know that from other vaccine programs. So what I think we will need to do is to give people the opportunity to speak to somebody. So calling up people that haven't responded to vaccines and actually going through their fears with them and going through their questions with them will be really important, and is really important, to make them see that that is, the service is for them. And I think the other thing that came out is having vaccine clinics in mosques, in churches, in other places, in community centres, and seeing community leaders purporting the vaccine and encouraging the vaccine is really important as well. So I think it needs all of those factors.
Well, it's been really important talking to you. Thank you to my panel. We're saying goodbye now to Dr. Zubaida Haque and Helen Donovan. But it's not over yet, because coming up after the break, we'll discuss some of those conspiracy theories we've been talking about circulating around these COVID vaccines and the role of social media. Much more on that. And I'll be joined by two new panellists, including the clinical researcher with the Oxford Vaccine Group. Stay with us. Now, I want to introduce our new panel to you now. Dr. Faith Uwade, an immunologist with the Francis Crick Institute, Dr. Maheshi Ramasamy, a senior clinical researcher at the Oxford Vaccine Group and consultant physician at Oxford University Hospitals NHS Foundation Trust. And staying with us is Imam Kari Azim, the Chair Mosques and Imams National Advisory Board and Chair of Leeds Mosque. Very good to see you all, and still an awful lot to get through, because in this section we'll be discussing misinformation and theories that could be contributing to vaccine hesitancy, also the role of technology and, of course, social media in the spreading of that misinformation. Well, let's start with our new panellists. And you, Dr. Uwade. I mean, there are broadly some pretty wild theories out there about these vaccines.
Yeah, there's quite a lot of misinformation circulating around all around the community. A lot via social media, a lot via WhatsApp messaging. People have real fears about the vaccine maybe altering their DNA, or a 5G and microchipping. It's quite a lot of misinformation spreading around. Yeah.
Yeah, I mean, you mentioned the role of social media in that. I mean, is it small groups, or some of those theories we've all come across? Some of them are widespread right across the globe almost.
Yeah, I think it's a mixture. Some of it is smaller groups, but some of it is just stuff that's being forwarded or shared quite readily from friends. Or there's big conspiracy theories that you're seeing that are just spreading amongst the community really, really easily. I think it's just a mixture of small and big things. But the idea is once people latch on to a conspiracy theory, they seem to latch on to quite a few more.
But how strongly held are some of the beliefs? I mean, you mentioned, for instance, let's pick on one, the altering of people's DNA and some of that. I mean, following the way that developed, it's because some of the vaccines are coming through that mRNA route. Are people just getting confused?
Yeah, I think the root of that initially is exactly what you said. It's the idea that people hear RNA and they think that's very closely related to DNA, and they think that must be altering my DNA in some form or way. But these conspiracy theories, they often take a shred of a bit of information, and it can be a little bit of misunderstanding of the science sometimes that can embed these theories. And I think the people who have these ideas, they sometimes can be quite strongly held. But for some people, they've just heard that misinformation and they haven't heard the real facts. So that's the main bit of information that they're getting. So it's just about filling that with real and correct information, and then generally they'll change their mind or at least do some further research on it.
And Dr. Ramasamy, you come in on this, and I know you just joined us, but you overheard our previous conversation. You're in a position to tell us a little bit more about, let's start with that, about the effect of vaccines on pregnant women or those who wish to become so.
That's right. And that's a question I get asked quite a lot by my patients. Are vaccines safe in people who are planning pregnancy or people who are pregnant? Now, the two vaccines that are available in the UK are the mRNA Pfizer vaccine and the viral vectored Oxford AstraZeneca vaccine. Neither of those vaccines can cause COVID-19 disease. Both of those vaccines are safe in people are safe in people whose immune systems don't work very well. We worry in pregnancy because we at the moment don't have enough data of people who've received the vaccine in pregnancy, and that's because in the clinical trials we don't normally recruit people in early clinical trials who are planning to get pregnant or who are pregnant themselves, and that's just routine procedure. But there's no reason, given that these vaccines can't in themselves cause disease, that it would be likely to cause any problem either to the pregnant woman or to their baby. So the guidance now in the UK is that if somebody is at risk of contracting COVID-19 infection, for example, if they're a healthcare worker and are occupationally at risk, or if they have another healthcare condition that means that they are otherwise at risk of severe COVID disease, such as heart disease or lung disease, then they can be vaccinated. But it's an individual decision. So someone who's planning to get pregnant or who is pregnant should talk to their GP, talk to their healthcare practitioner about what's the right thing for them and weigh up those risks and benefits for themselves.
Well, thanks for clearing that up. And just let me underline to our audience where that's come from, the senior clinical researcher with the Oxford Vaccine Group. So you know all about that. Tell me about, though, Dr. Ramasamy, your concerns, and are they deep concerns about the level in some communities of misinformation about the vaccines?
Yes, it's really dispiriting to hear that people from ethnic minority groups are not taking up the vaccine. You know, as a clinician, that's who I see coming into my hospital with bad COVID. You know, people who are elderly, people from ethnic minorities, and people with comorbidities. And to me, it just seems really frustrating that people who are at the most at risk are not accepting a vaccine that's safe and effective, that would protect them, that would stop them from getting this severe disease in the first place.
And Imam Karyassim, I mean, we've got to look at this misinformation. It's not as if it's in isolation. This is part of a wider distrust illustrated in so many ways, so many different ways, an overall distrust of authority figures, of authority organisations, the idea that somewhere there's a hidden agenda.
As chair of Mosques and Imams National Advisory Board, we've been holding webinars across the country and trying to hear people's concerns, trying to listen to those concerns and then respond to them in a way that people can relate to. So some of the things that we come across include structural and health inequalities. In particular, amongst young people, there is greater lack of trust and mistrust of authorities. Lack of meaningful engagement between public institutions and grassroots is also another cause for this lack of trust amongst young people. And so a combination of vulnerability and distrust of those in authority manifests itself in defensiveness. And just to highlight that by way of an example, I was mediating in a particular family scenario where father had been lost to COVID-19, sadly. Mother, elderly mother, really obviously wanted to protect her life and take the vaccine, but one of her sons was quite into the 5G radiation and some of the misinformation. And so it took a while to talk to the family, trying to help the young person make an informed choice, because misinformation in this pandemic can cost lives. And I think we all need to understand that the people are not hesitant to protect life or expose themselves or others to risk, but there are underlying reasons why some people are hesitant, and we need to work with those communities.
Well, let me talk about, you talk about costing lives, about specific locations where it could cost lives, where lives are attempted to be being saved. Dr. Uwade, and I'm talking here about NHS hospitals, about care homes, and a disproportionate number of ethnic minority people work in these locations. And if they're turning down the vaccines, how concerned are you about that?
Yeah, as you can imagine, I'm pretty concerned about it. Like you said, we're disproportionately affected. So you'd hope that we would be the first people rushing to take the vaccine. But it's like what was said before, it's that mistrust and it's that worry that makes people to worry about whether or not they should actually take it, and makes them stop and think before they make that decision. I mean, personally, I think that I would like as many people to take up the opportunity. For me, both my parents have now had their first dose, and I'm more than happy, and I'm really excited for them to know that they are now at least somewhat protected from this horrible disease. But of course, I'm really, really concerned in the way that I'm sure that most people who are scientists or clinicians are worried about the fact that, we need to move past this pandemic. And one of the ways to do that is with vaccination. And we need to vaccinate people who are most vulnerable. And today we're talking about those people who are vulnerable because of their backgrounds, such as ethnic minorities.
And Dr. Ramasamy, just on that specific point about locations where sections of the people who work there are turning down vaccines, and we're talking about NHS hospitals and care homes, where, of course, the vast majority of deaths occur. This is a real concern.
That's right. It's a concern, partly because many people contract COVID within these settings. So people come into hospital with something else and then they catch COVID in hospital. And that could be related to healthcare workers transmitting infections unknowingly, and the same in care homes. But also, healthcare workers are trusted members of communities. People look up to them and look to them for advice. And if they are hesitant to take up the vaccine, then that makes it very difficult to promote good messages in communities.
OK, stay with us. Another break coming up. But after that, we'll be talking about the possible solutions and how the government and community leaders hope to tackle this misinformation. Stay with us. Now, in the final part of tonight's special programme, we would like to discuss what perhaps can be done to try to increase the uptake of vaccines by Black, Asian and minority ethnic groups. In today's Downing Street news conference, the NHS Chief Executive, Sir Simon Stevens, called it a dual epidemic, a pandemic of misinformation and, of course, a virus pandemic.
There is a huge effort involving community leaders, faith leaders, the way in which the NHS itself is administering the vaccine programme to overcome that. And although the start was slower in terms of the uptake in some of those communities, I think we are now seeing meaningful progress. Part of what we're up against is a dual epidemic. We're up against the pandemic of COVID, and we're up against a pandemic of disinformation and the deliberately sowing of mistrust.
The deliberate sowing of mistrust, a pandemic of misinformation. Well, Imam Kari Azim, you've been talking to us throughout the course of this hour, what you're doing personally to try to counter this misinformation. But of course, that's not enough. What more do you think, or do you feel, if you do feel, the government should be doing?
I think sometimes we talk about that there are communities who are hard to reach, but it's not that they are hard to reach, but we need to reach them in a way that's amicable and culturally sensitive, as well as a culturally tailored message. In this pandemic, the messenger is as important as the message itself. But through the work that Minab has done, we've seen that actually the tide is turning. The people who were hesitant at the beginning, in our communities, by opening the vaccination centers in mosques, by delivering sermons during Friday prayers to the members of the Muslim congregation, as well as holding webinars with those communities, we are seeing that actually people are overcoming their hesitancy. And so if there is communication issue or access issues, we can have vaccination buses to those communities where people perhaps will be reluctant to go to if there's vaccination center further away. So there's a lot that can be done. But I think in this pandemic, the messenger is really important, as well as reaching those communities and alleviating their concerns rather than dismissing those concerns.
It's Dr. Ramasamy, that's an important point, isn't it? Because if the messenger, aka the government, is mistrusted, it's more important then that the message comes across from those that are trusted, and they very often are those closer to the ground. They're amongst the communities.
I think that's right. There are several government websites, so the NHS website, for example, which has lots of information about vaccine safety. But I think if there is mistrust in the system, in the government, then perhaps those aren't the places people are going to look for independent, trustable sources of information. So I think what we need individuals to stand up. We need healthcare workers to stand up. We need community leaders to stand up. It might even be as simple as having experts that look like you. Those are the people that individuals and communities will believe in. But it's also having the right forum. It's not having lectures or websites or talks. What people really need is an opportunity to be able to put forward questions and to be able to have those answered honestly and accurately and without any vaccine shaming, without any judgmental views. That's really important, and that's difficult to achieve on a large scale.
And your thoughts on that, Dr. Uwade? I mean, if the government is perceived rightly or wrongly to be the source of many problems, wider problems within a community, it's not then necessarily the source to shoot down some of this misinformation. Where do you think it would best come from?
Yeah, no, I agree with what other people on the panel have said. It's about coming from a trusted voice. The government isn't necessarily the source that you'll look to. So it's generally coming from someone who's close by. It could be a family member, like, for example, myself. As a scientist, I've spoken to many people who I'm close to, friends and family, about the vaccine and why it's safe. And I think because people trust my opinion and they know that I know what I'm talking about, it's a good source of information. But even if you don't have a scientist nearby or close to you in that same way, there are people on social media working towards making sure that people can get access to good sources of information. So, for example, I'm part of a group called Team Halo, and it's a group of scientists who work on COVID-19, but also other scientists, and they're just trying to communicate good information, and we're doing it via the form of TikTok. And that's one of the ways that we're able to get people who are much younger. And it's those younger people who can also inform their parents and other people within their community. So it's almost like creating a ripple effect where if you let one person understand the importance of vaccination, that will go on and extend within itself. And yeah, so that's kind of where I think it is. I think webinars, talking to people within the community, going and talking to faith groups as well, but also just remembering that you and yourself, you can actually communicate and do research yourself and then spread it on to other people near you as well.
Keep it local. Ashna, just very quickly, that's what you've been discovering in your reporting.
Yeah, absolutely. It is about those role models. It's about people hearing from trusted sources. The government, in some ways, is doing some of that. Public Health England are
We're out of time. Ashna, thank you very much indeed. And thanks to all my panel here for a most illuminating and informative conversation. Do stay with us here on Sky News.